In this session, we are going to be looking at the history collection of the GI system. Hi everyone, I'm Sharon. I'm working as an assistant professor at College of Nursing. The following are the few objectives that we'll be addressing in this session. Evaluation of the gastrointestinal tract requires careful history and physical examination techniques. Though sophisticated lab tests or radiographic or endoscopic procedures may be necessary to confirm a diagnosis of intra-abdominal pathology, the initial diagnosis is usually suspected from the history and further reinforced by physical examination. In the subjective data, we'll be trying to collect the important health information such as the past health history, the medications, any surgery or other treatment that the patient has undergone. In the past health history, gather information from the patient about the history or existence of the following problems related to GI functioning, such as abdominal pain, nausea and vomiting, diarrhea, constipation, abdominal distension, jaundice, anemia, heartburn, dyspepsia, changes in appetite, hematemesis, food intolerance or allergies, indigestion, excessive gas, bloating, melena, hemorrhoids, and rectal bleeding. Further, question the patient about weight history. Explore in detail regarding any unexplained or unplanned weight loss or gain within the past 6 to 12 months. And also document a history of chronic dieting and repeated weight loss and gain. Ask about the past and current use of medications. Some drugs are potentially hepatotoxic. Example, acetaminophen and NSAIDs, that is non-steroidal anti-inflammatory drugs. These drugs can predispose to upper GI bleed and with an increasing risk as a person ages. Also ask regarding the history of antibiotic intake because this can change the normal bacterial composition resulting in diarrhea. Ask about antacid and laxative use as they affect the absorption of certain medications. Obtain information about hospitalizations for any problems related to the GI system. Also obtain data related to any abdominal or rectal surgery, including the year, reason for surgery, postoperative course, and possible blood transfusions. Now, let's look at the history collection with regard to the functional health patterns. The first one being the health perception health management pattern. The nurse should ask about the maintenance of normal body weight, any specific measure done to maintain it within the normal level, attention to proper dental care, maintenance of adequate nutrition, and effective elimination habits. Also ask regarding exposure to any hepatitis or parasitic infestation, any risk behaviors for hepatitis C exposure, and also document regarding any vaccinations received for hepatitis A and B. Also ask related to habits that may directly affect GI functioning such as alcohol consumption and cigarette smoking. Chronic alcohol exposure can cause fatty infiltration of the liver, which causes damage leading to cirrhosis and hepatocellular carcinoma. And nicotine is irritating to the GI tract mucosa, which leads to GI cancer, especially the mouth and esophageal cancers, esophagitis, and ulcers. Smoking further delays the healing of ulcers. Family history is another important component that needs to be asked because of the relationship between colorectal cancer and breast cancer. Hence, inquire about a history of either type of cancer in the family. And women with hereditary non-polyposis colorectal cancer also have an increased risk of developing endometrial and ovarian cancer. With regard to the nutrition and metabolic pattern, a thorough nutritional assessment is essential. Take a diet history and inquire about both content and amount, that is the portion size. A 24-hour dietary record can be used to analyze the adequacy of the diet. whereas a 1-week recall may provide additional information on usual dietary patterns. Compare weekday and weekend dietary intake patterns in relation to both the quality and quantity of food. Also ask the patient about the use of sugar and salt substitutes, use of caffeine, and amount of fluid and fiber intake. Note any changes in appetite, food tolerance, and weight. Anorexia and weight loss may indicate cancer or inflammation. Decreased food intake can also be the consequence of economic problems as well as depression. Ask about food allergies and what GI symptoms occur with the allergic response. Inquire about dietary intolerances, including lactose and gluten. With regard to elimination pattern, inquire the frequency, time of day, and usual consistency of stool. Document the use of laxatives and enemas, including the type, frequency, and results, and also investigate any recent change in the bowel pattern. Also document the amount and type of fluid and fiber intake, as these can influence the frequency and consistency of stools. Inadequate intake of fiber can be associated with constipation, and also investigate the possible association between a skin problem and a GI problem, as food allergies can cause skin lesions, pruritus, and edema. Diarrhea can result in redness, irritation, and pain in the perianal area. External drainage systems such as an ileostomy or an ileal conduit may cause local skin irritation. With regard to activity exercise pattern, assess the ambulatory status of the patient to determine if the patient is capable of securing and preparing food. If the patient is unable to do these tasks, determine if a family member is meeting this particular need. Assess for immobility, as it is a risk factor for constipation. Also note any limitation in patient's ability to feed themselves. Assess for the access to a toilet. Identify the use of and access to supplies such as a commode or ostomy supplies. In sleep rest pattern, assess for any sleep disturbances that can be caused by GI symptoms such as nausea, vomiting, diarrhea, indigestion, and bloating. For example, a patient with GERD, that is gastroesophageal reflux disease, may be awakened in the night because of burning and epigastric pain. Ask for any particular bedtime ritual that a patient follows, such as a food or beverage. Herbal teas may be sleep-inducing. Document these individual routines and comply with them whenever possible to avoid sleeplessness. Hunger. It can also prevent sleep and should be relieved by a light, easily digestible snack unless it's contraindicated. In cognitive perceptual pattern, assess for any changes in sensation, as they can have or cause problems related to acquisition, preparation, and ingestion of food. Changes in taste or smell can affect appetite and eating pleasure. Vertigo can make shopping and standing at a stop difficult as well as dangerous. Heat or cold sensitivity can make certain foods painful to eat. Also ask related to any acute or chronic pain, as this can influence dietary intake. Behavior associated with pain will include avoidance of activity, fatigue, and disruption of eating patterns. Assess patients receiving any opioid medications for constipation, nausea, sedation, and appetite suppression. With regard to self-perception, self-concept pattern, many GI and nutritional problems affect the patient's self-perception. Overweight and underweight persons may have problems related to self-esteem and body image. Repeated attempts to achieve a personally acceptable weight can be discouraging and depressing for some people. The way a person recounts a weight history can alert you to the potential problems in this particular area. The need for external devices to manage elimination, such as a colostomy or an ileostomy, may be challenging for some patients. The patient's willingness to engage in self-care and to discuss the situation provides you with valuable information related to body image and self-esteem. The altered physical changes, often associated with advanced liver disease, can be disturbing for the patient. jaundice and ascites cause significant changes in external appearance. Assess the patient's attitude towards these changes. In role relationship pattern, problems related to the GI system such as cirrhosis, hepatitis, ostomies, obesity, and carcinoma may alter the patient's ability to maintain usual roles and relationships. A chronic illness may necessitate leaving a job or reducing work hours. Changes in body image and self-esteem can also affect relationships. With regard to sexuality reproductive pattern, changes related to sexuality and reproductive status can result from problems of the GI system. For example, obesity, jaundice, anorexia and ascites could decrease the acceptance of a potential sexual partner. An ostomy could affect the patient's confidence related to sexual activity. Hence, sensitive questioning can identify potential problems. Anorexia can affect the reproductive status of a female patient. Obesity leads to reduced fertility and increased miscarriage rates in women. With regard to coping stress tolerance pattern, determine what is stressful for the patient and what coping mechanism the patient uses. Factors outside the GI tract can influence his functioning. Both psychological and emotional factors such as stress and anxiety influence GI function in many people. Stress may be manifested as anorexia, nausea, epigastric and abdominal pain, or diarrhea. Some diseases of the GI system such as peptic ulcer, inflammatory bowel disease, irritable bowel syndrome may be aggravated by stress. However, GI symptoms should never be attributed solely to psychological factors. In value belief pattern, assess the patient's spiritual and cultural beliefs regarding food and food preparation. Whenever possible, respect these preferences and also determine if any value or belief could intervene or interfere with planned interventions. For example, if the patient with anemia is a vegetarian, the prescription of a high meat diet should be resisted. Hence, thoughtful assessment and consideration of the patient's beliefs and values usually increase adherence and satisfaction. The following are the references for this particular session.